steps involved in the recruitment process. They are position assessment, understanding the requirement, vacancy, company profile, culture, ethics to source the right fit employee, advertising the vacancy and sourcing the right candidates to job portals, screening and identifying candidates, screening the candidates from resume pool as per the requirement of the candidates, promoting client and position, communicate about the company profile and the vacancy to potential date candidature. Candidate profile submission. A preliminary interview assessment report submitted by the HR solutions to the client for the judgment about the expertise of the candidate and suitability as per the requirement. Facilitate the client and candidate connection. Facilitate the connection between the client and the candidate for the rounds of interview, selection and follow-up. Follow up the clients regarding the selection and rejection report and communicate to the candidates. So this is how the group of employees from where a group of candidates from where a right candidate selected for the post of an employee in an organization is in the hospital. Selection. So selection, the process of selection leads to the employment of person having the ability and qualification to perform the jobs which have fallen vacant in an organization. The basic purpose of selection is rejection of the unskilled candidates and choosing a right type of person on various positions in the organization. Steps in the selection procedures: interviewed by the personnel department, pre-employment tests such as written, oral and practical, interview by departmental heads, decision of administrator to accept or reject, medical examination, check of reference, issue of appointment letter, placement. Stages of selection procedure. Interview. It is the most intricate, difficult part of the selection process. It can be divided into 4 parts: warm stage, drawing out stage, information stage, forming an opinion stage. Pre-employment tests. To ensure selection of most suitable candidates for various posts, interviews should be conducted carefully. Pre-employment tests should be held in systematic manner wherever necessary and possible. Tests can be divided into 4 types: test for general eligibility, test for specific eligibility, test of achievement and personality. The final approval by the head of the institute. After the personnel department committee completes their selection process, they send the application to the head of the institute for final approval, who generally hiring or the hiring authority. In hospital, the head of the hospital may prefer to interview all the candidates himself for the key jobs and leave it to the selection committee for the less vital jobs. Reference. Reference provided by the applicant should be cross-checked to ascertain his past performance, to obtain relevant information from his past employer and others who have knowledge of his professional competence. Medical examination. Medical examination of a prospective employee is an aid both to the employee and to the management. The selection of the right type of employee who can give his best and to be happy requires thorough knowledge of his physical capacities and handicaps. Issue of appointment letter. After all this selection, the important step comes is the issue of appointment letter, which gives legal right to the employee and the welcoming offer to be a part of this prospective organization. Placement. Placements of credits bearing part of the degree course. If a student opts out of the placement or there is no placement available, this means the placement is not guaranteed. Important. So this placement is on an online procedure from the sites of the candidates who are applying for a job. So importance to fairly and without any element of discriminative evaluate the job applicants in the view of individual differences, to employ qualified competent hands, to place job applicants in the best interest of the organization.